So I'm in rural China working on a study on liver cancer, our study of dealing with how we can increase the detoxification pathways in people who are unavoidably exposed to air pollutants, toxins in their foods. It's cold, there's no central heating, there's no running water, and my cell phone worked. And I got the email from Bill and Margaret about this award, and this really warmed me up. So I thank you all. I thank Tom and Bill and Margaret and everyone involved in lesscancer.org for this wonderful honor. So it's really tough for an academician not to have PowerPoint, not to have a blackboard, not to have any of the tools of our trade. But what I wanted to try and do, I did bring my computer. What I wanted to try and do was to share with you some aspects of cancer prevention, some goals, and in particular, really emphasize that change happens and that change that you do during the course of your life can really impact the diseases that you might suffer from decades later or be prevented from. And again, all of us involved in prevention deal with the issue that there really aren't any grateful patients who did not get a disease. And so we're always, as we deal with prevention, dealing with the issues of those people who get in treatment following a diagnosis versus all of us who didn't get disease because of the prevention efforts that have happened over the last 100 years. So I'm going to share some of these stories with you and some of the themes with you. And the first story, or the first game I want to play, really is built upon this theme that you've heard about the moonshot. You know, Vice President Biden, dealing with this challenge of the moonshot in cancer. Well, I remember when people landed on the moon in 1969, and that got me to thinking, and I thought we would play a little bit of a game. So could everyone kind of look around at each other? So look to your side, look to your left, look to your right, look to the floor, look to the ceiling, look around at all the people who are here today. And imagine that this was 1969, and everyone in this room would have died of heart disease or stroke. 1969. Now I want everyone to stand up. It's okay. Yeah. This is a little exercise. Stand up. Now look around at all the people that are here. There are a lot of people here. Now, let's say this front row, sit down, front table, and that table there, you can sit down too. Now, all of you standing are the people who would not have died of heart disease or stroke in 2015. This small fraction of people, about 20% in this room, are the people who would still suffer from heart disease and stroke. Prevention, new drugs, better diet, better interventions, control of hypertension, means that all of you who are standing now are the ones who would never have to suffer from heart disease and stroke. That's a success of prevention over the last 35 years. Now, all of you standing can sit, and those of you who are sitting, stand. This is the small fraction of people for whom we've had success in cancer prevention over the last 45 years, whereas we've had almost an 80% reduction in cardiovascular disease death, we've only had a 17.9% reduction in cancer deaths. This is the challenge that we're facing in cancer prevention. Thank you. So I want you to remember as you look around the room that it's not just individuals, but it's we as societies. We've had tremendous successes and we have tremendous challenges to go forward. So heart disease is down by 75 to 80%. Cancer is down by only 17.9% over the same period of time. My colleagues in cardiovascular disease will say, well, we're just better. The reality is that cardiovascular disease is a little bit simpler biologically. It can be modified by reducing tobacco consumption. We have a lot of good drugs for control of hypertension and the like. Cancer is really tough. Cancer is not just cancer, it's 100, 150 different diseases. So it's a tough one, and it's something that many of us are actively involved with. I also want to emphasize now that I work in global cancer. I'm not just in Baltimore, most of the time. I work in many different parts of the world, and I want to lay out, particularly for a lot of the younger investigators here, that cancer is a global problem, and 2/3 of all the cancers diagnosed on our planet by the year 2050 will be diagnosed in Asia. This is because of the population growth, the youth, the changing life expectancy. And one of the things that I want everyone to remember is that we in public health and we in prevention think of things as they change over time. We look at data longitudinally, and we can predict that with the changing of life expectancy, that the populations at greatest risk for cancer will be in Asia by mid-century, and with hopefully greater success in terms of the treatment of HIV/AIDS and a number of diseases in Africa. Africa, by the end of this century, will have an increase in life expectancy because cancer is a set of diseases that increase as you get older. And again, roughly 90% of all cancers are diagnosed in people over the age of 45, and we must remember that this is a global problem. The cancers and the health problems of people in Asia and Africa impact those of us in the United States or in Europe. We are a global set of issues when it comes to public health and the rights of people to live well. So cancer is going to rise. This is a fact. The slope of that rise we can impact with respect to prevention, and there are many of the things, as I'll share with you, that we can do to affect this right now and continuing through our lives. When I look at the map of the world and I ask, what kinds of cancers do people die of around the world? And when I look in men, it's lung cancer. Now, do we know what causes lung cancer? This is where you all say yes. All of you can name the number 1, 2, and 3 major causes of lung cancer. Tobacco smoking, tobacco smoking, and tobacco smoking. Why do we have so much tobacco smoking? Well, this is an easy way for country after country to raise taxes by addicting their populations to tobacco in order to raise money. It's a wrong. It's a wrong that gets replicated in country after country, and it's the reason why we see so much lung cancer, particularly in men, across the world. But cancer is a development, it's a biology that takes a long time. So a person who comes into Johns Hopkins and is diagnosed with lung cancer today, that cancer didn't start last week. It didn't start last month. It could have started in 1965 or 1975 or 1985. It takes 20, 30, 40 years for the initial cells to go along to that progression to develop a tumor. So the cancers that we diagnose today are the cancers that were initiated in the 1970s, the cancers perhaps at the time of the original moon landing. That's what our tremendous opportunity in prevention lies, is that the long period of time that it takes for cancer development gives us an enormous window of opportunity to affect change. This is not like a mosquito bite where you might get the infection very soon thereafter. This is a long, slow, progressive progress. The other aspect is that the biology of cancer, the biology of a tumor of somebody here in the United States, pretty much the same biology if that person's in Bangladesh, in rural China, in sub-Saharan Africa, or in Central America. So this gives us tremendous opportunity that which we learn about prevention here can have applicability worldwide. Now, as mentioned earlier, and it's something that I want to emphasize, and I think it's wonderful that the issue of the papillomavirus vaccine was raised. This is a tremendous, staggering advance in our prevention armamentarium. 265,000 women die of cervical cancer worldwide each year, mostly in South Asia, from Bangladesh, India, through Central Africa, and in Central America. No woman should die of cervical cancer on our planet in the year 2016. If you want to take on a challenge to eliminate a cancer well within your lifetime, eliminating cervical cancer deaths is achievable, not only through the vaccination, but through the development of screening and the implementation of something as simple as reading a Pap test, a tool that we've had in our quiver for 75 years. No woman should die of cervical cancer on our planet. There were 57 cervical cancer deaths in the state of Maryland last year. This is something that is preventable, and it has a complete and tremendous impact, not only on lives, but impact on our ability to deploy available technologies that we have for free in many parts of the world. So I want to come back to the theme of it's never too late to start prevention. And there are success stories to point to this. Oftentimes, deans and other people sort of come to me and they go, well, you know, you talk about prevention, but it doesn't really make any difference. Can you show me that it makes a difference? And you go, well, okay, you know, once again, you have to talk about how we had this tremendous increase in lung cancer in the United States in men and women over the course of the 20th century, and we've had this tremendous decline over the last 20 years. We've had all sorts of changes of some of the major cancers in this country over the course of time. That didn't happen by chance. That happened because various things changed. We were able to intervene and change even when people were 40 years of age or 35 years of age or 20 years of age. You can change the trajectory of cancer. So some of us here are old enough to remember the wisdom of Congress that really helped to push through something as simple as, you know, it's not such a great idea to smoke on airplanes. That was 1989. You used to get on an airplane, and it was bad enough when it was cigar smoking on airplanes, but you would get on an airplane and you'd fly from, let's say, New York to Los Angeles, and you'd take off your clothes and you wouldn't wear them again because they stunk. And then when you would fly back from Los Angeles to New York, you'd put those same clothes back on because why stink up some new clothes? Because of the smoking on planes. Can you imagine that? You got this aluminum tube, this controlled environment, and all the air, and we remember that. That was 1989. So for many of you, you've never grown up in an environment where cigarette smoking was so prevalent. I was lecturing to some of the undergraduates at the Hopkins a couple of years ago on tobacco, and you can tell, believe me, you can tell. The undergraduates there, you're talking about things, and they look at you like, what are you talking about? And then I asked them, I said, well, how many of you have parents who smoke? Not a single person raised their hand. And I went, no wonder they're giving me this look like, what are you talking about? Well, among the very privileged in that room, they have no firsthand experience in tobacco smoking. Go to most parts of the world and it's very different. Because of the change in tobacco consumption in the United States, there are now 1.7 million Americans living who would have died of lung cancer and other cancers since 1989. 1.7 million people. That's 3 times the population of Washington, D.C. So when your grandmother or somebody asks you, does prevention make any difference, remember that we've had a tremendous change just in the last 25 years because of dealing with issues of tobacco. 1.7 million Americans. But we got a long way to go, because even if we eliminate all of tobacco, we still have a lot of issues with respect to lung cancer risk from air pollution, radon exposure, and many of these other types of pollutants. So remember, think of things that we can change and things that we can prevent, but always remember it's like the wooden sword in Dracula, where you have to constantly be hammering it through the heart, because if you don't, these things tend to pop out. And that's what you were just hearing about e-cigarettes and some of the other tobacco-related issues. We've made a lot of progress, but this keeps on coming back at every full moon. In our own work, we work on liver cancer, and we've been able to characterize, as Margaret mentioned, the contributions of a food contaminant, aflatoxin, to the development of liver cancer. I work in various communities in the world where 15% of the people die of liver cancer, and we've been able to document and be involved in the reduction of almost 45% of liver cancer deaths. And liver cancer is a terrible disease. You know, the average time from diagnosis to death is usually 3 to 4 months. So it's terribly difficult to manage and to treat, but we've been able to see reductions through interventions and the work that we do in trying to base food-based strategies based on our mechanistic science in order to increase the ability of people to deal with these exposures is the reason why we're involved in these clinical trials, both in China and in sub-Saharan Africa. Now, I recognize that I'm in a building housing members of the House of Representatives, and so that makes me want to think in terms of states and changes. And I happen to live in a little state, and it's a state called Maryland. And Maryland is 10 electoral votes, so I guess that's the same as Massachusetts, but it's a relatively small state. But 30 years ago, in 1985, it was absolutely stunning to see that Maryland had the second highest cancer death rate in the United States. Little tiny state, now the second wealthiest state in the country. Second highest cancer death rate in the United States. And several years after that, the late William Donald Schaefer, who was the governor of Maryland, he'd been mayor of Baltimore prior to that, sort of said, how can it be that a state that has Johns Hopkins University, the University of Maryland, and do I remember the National Institutes of Health and the National Cancer Institute have the second highest cancer death rate in the United States? This isn't right. So by the way, what was number one? No, it wasn't Kentucky. No, what was number one? Take a guess. Yell out. Well, we have New Jersey. It's not. Sorry? Oh, we have Tennessee. It's not Tennessee. Yeah. Florida. No, it's not Florida. What? Mississippi. No, it's not Mississippi. This is a trick question. It was Washington, D.C., okay, is number one. So what was number three? Virginia? No, it's not Virginia. It's a state next to Virginia. West Virginia was number three. Number four was Joe Biden's home state, Delaware. So the number 1, 2, 3, and 4 in terms of the highest cancer death rate in the United States, Washington, D.C., Maryland, West Virginia, and Delaware, this mid-Atlantic region. A lot of changes happened. Maryland was a tobacco-growing state for 300 years. We're now 31st. We've gone from number 2 to number 31 over the last 30 years through a variety of interventions, a lot driven by tobacco, a lot driven by healthcare accessibility, and a lot of issues in that way. Which state has the lowest cancer death rate in the United States? No. Alaska? No, not Alaska. And it's not Missouri, no. Utah has the lowest cancer death rate. So basically, there is our achievable improvement in cancer death rates of going from the highest in Kentucky to the lowest in Utah, and I'll come back to that in a few seconds. But there's a lot of, within our small state, some enormous problems that we face. One of those problems is that Baltimore City still has the highest cancer death rate of any city in the United States. Only 40 miles away is Montgomery County. Montgomery County, one of the wealthiest counties in the state, with an incredibly low cancer death rate. Indeed, life expectancy among most neighborhoods in Baltimore City is 62 years of age. In Montgomery County, it's 84. So, and that is replicated in every major urban area. So the disparity issues, we still have a lot to overcome in that regard. And we see it played out in cancer death rates in breast cancer, prostate cancer, cervical cancer across the board. State by state in the United States, we still have tremendous health disparity. So in looking at the most recent data, Kentucky has the dubious distinction of having the highest cancer death rate in the United States, and it's 60% higher than Utah, which has the lowest. So again, as we look at things, and oftentimes people look at things as being, well, there must be underlying genetic factors and so on. Now, these are environmental factors, and it's environment in the broadest context in terms of diet, smoking, what we're exposed to, pollution, and so on. And the states with the heavy industrial legacies are the states that are certainly seeing the brunt of this burden first. So lung cancer in Kentucky is 4 times higher than it is in Utah, a state with the lowest tobacco consumption in Utah, with a state with pretty much the highest tobacco consumption. You've heard that before. In prostate cancer, Washington, D.C. has a 2.5 times higher prostate cancer death rate than Arizona. These are things that are preventable with the tools that we have available to us now. I'll leave you with 2 more thoughts and then close it together, because I want to talk about the enormity of the impact of our diet on cancer risk, and try and frame it in a way that perhaps you haven't thought about it before. And I use this in class because it's kind of one of those stunning little issues. So look at me and pretend for a moment that I'm a normal human being, and you want to know, well, what did you eat last year? Well, I ate 202 pounds of vegetables last year. If I'm a normal American, 39 pounds of that would be potatoes, but 19 pounds of those potatoes would be potato chips. And on this Sunday, there will be mostly potato chips. 126 pounds of fresh fruit, that sounds pretty good. 111 pounds of red meat, maybe not so good. 74 pounds of poultry. 233 pounds of dairy products in the course of a year. But I would consume 137 pounds of caloric sweeteners. So yes, the average American eats more caloric sweeteners than fresh fruit. That should not be part of the American dream. But if you looked at me in 1990 to where I am right now, I'm now eating 120 pounds more food each year than I was in 1990. So it's not just the constituents and what's in the food, but obviously the amount that raises us to what we are today. And many of the issues that we see in chronic disease and in cancer, and the disparities that we see not only across the United States, but also by looking at Caucasians, African Americans, and Hispanics, we see enormous disparity with respect to obesity and impact on cancer, and this is particularly played out in the African American community. And this is a wrong that we can correct. So let me end with what the challenge is, or as we think forward, and in particular, it's a challenge that I hope that, how many of you, this is not a HIPAA thing, how many of you are under the age of 20? Just raise your hand. That's pretty cool. So you're under the age of 20. That means you're going to live to the 22nd century. Think about that. You got another 80 years ahead of you. That's pretty good. So you're going to make it to the 22nd century, and in that century, you would like to see an impact on health. So one of our challenges is that we're great scientists, and we really are. We're great molecular scientists. We can characterize and have characterized a phenomenal number of genes that are involved in cancer and chronic disease and human genome-related impact. We're very good at that. We've done a great job with that. But using that data and now impacting it on prevention, is a real challenge. And let me leave you with two vignettes. And the first vignette is, you've heard from a number of us already about the devastation at the time of a diagnosis of a cancer or diagnosis of one of these diseases. But what I want you to be reminded of is that at the time of that diagnosis, 90% of the biology has already occurred. From the time of that diagnosis, there's only about 10% of the biological change that will occur. 90% will have already occurred over the prior 30 years of that cancer development. That's our window of prevention. That's the time before diagnosis where we can impact and blunt the disease, and we've been successful doing that, hopefully illustrated by some of the changes that I've described to you earlier. And pay attention to Graham's golden rules. Graham Colditz. Graham's golden rules are dealing with the issues that if we address smoking and obesity and exercise and general diet, we can reduce cancer by at least 54%, well within the next several decades. So now, I'd like to end the game by having everyone stand up. And look around. No, again, look to your left, look to your right. And this is the world without cancer. Thank you.